Welcome to Angel Health Academy. Topic for the day or topic for the session is types of illness or types of disease. Types of illness or types of disease can be broadly categorized or classified based on their cause, etiology, based on their duration of illness, short or prolonged, and based on the severity, mild, moderate, and severe, okay, with the complication and fatality of the disease, okay. So illnesses can be broadly classified into or categorized based on three factors, that is based on their cause or etiology, based on their duration, the period of time, the lasting period of time, and based on their severity. The major type of illnesses or major type of diseases are acute illness, chronic diseases, infectious diseases, genetic and congenital disorders, mental health disorders, autoimmune disorders, cancers, degenerative diseases, nutritional deficiency diseases, endocrine disorders, neurological disorders, allergic conditions, occupational hazards or occupational diseases, lifestyle related diseases or lifestyle diseases, and others. So there are 15 different types or categories of illness or diseases, that is acute illness, chronic diseases, infectious diseases, genetic and congenital disorders, mental health disorders, autoimmune diseases, cancers, degenerative diseases, nutritional deficiency diseases, endocrine disorders, neurological disorders, allergic conditions, occupational diseases or occupational hazards, lifestyle related diseases or lifestyle diseases, and others. So there are 15 different categories of types of illness or types of diseases. Let us discuss in short about what are the different types of illness or diseases. First one is acute illnesses or acute disease. Acute illnesses come on suddenly. So there is a sudden onset. Beginning or starting is very sudden. Okay. And are typically it is short in duration. So it may not last for a prolonged period. It will get relieved or get recovered very soon. So it is sudden and short in duration. Sudden onset and short in duration. Then this can be either mild or severe. Okay. The severity of the disease is either mild diseases or it can even severe diseases. But it is often resolved with the treatment. It is often get recovered from the different type of or specific treatment. Examples for acute illness include common cold, okay, flu or influenza, that is a seasonal fever, appendicitis, inflammation of the appendix, that is appendicitis, even pneumonia, inflammation of the lung, pneumonia, etc. are the acute illness begins with sudden onset and it has only short duration, but it may be mild or severe. Second one is chronic diseases. It is just opposite of the acute diseases. Chronic illnesses are long lasting. It lasts for a prolonged period, okay, maybe through lifelong. And it is often progressive. It is developing or gradually developing. And this may develop slowly and persist for years or even a lifetime or lifelong, okay. So it develops gradually or it develops slowly, but it persists, it continues for years, okay, or even the lifetime or a complete life of the person or individual. That means these chronic diseases can significantly impact the person's or patient's quality of life. So it may disturb the quality of the life and it may require ongoing or continuous medical attention for a prolonged period or even lifelong, okay. So it can significantly impact the quality of the life of the patient or the person and which require ongoing or continuous medical attention or medical management or treatment. Examples of chronic diseases are cardiovascular diseases such as hypertension, heart diseases, stroke, and even diabetes, endocrine disorders like diabetes type 1 and type 2 diabetes, chronic respiratory diseases, that is chronic obstructive pulmonary diseases, that is COPD, asthma, bronchial asthma, etc. Another example is CKD, that is chronic kidney diseases, okay, and even arthritis. It includes osteoarthritis and rheumatoid arthritis. All comes under chronic disorders. Rheumatoid arthritis is the inflammation of the small joints. That is an autoimmune disease too, but it is a chronic disease. It may occur lifelong. Third type is infectious diseases. Okay, so it is caused by or they are caused by various pathogens, that is microorganisms such as bacteria, viruses, fungi, parasites, etc. Okay. They can spread either direct contact with the direct contact of the patient, or it can be even spread indirectly or even communicate indirectly through contaminated food, water and vectors. Vectors are nothing but mosquitoes, flies, etc., bugs, etc. Okay, these are vectors which cause diseases. That diseases called even vector-borne diseases like malaria, chikungunya, dengue fever, etc. Okay. So the example of infectious diseases are bacterial infection, that is tuberculosis, UTI, urinary tract infections, etc. Then viral infections such as influenza, COVID-19 or corona, HIV/AIDS. Then example for parasitic infections are malaria, giardiasis, etc. Okay. And example for fungal infections are candidiasis, ringworm or different form of dermatitis, all comes under fungal infections. Fourth classification is genetic or congenital disorders. As the term indicates, it may transfer from parents to children, that is genetic. Congenital means it occurs at birth. So these illnesses result from genetic abnormalities or are present at birth as congenital disorders. That means some of the diseases are inherited from their parents, while others are due to the mutation of the genes. So genes may get mutations, changes, genetic changes that may lead to different type of congenital disorders. Okay. Example for genetic disorders such as cystic fibrosis, sickle cell anemia, etc. Then for congenital disorders, Down syndrome, congenital heart defects, spina bifida, etc. These are some of the examples for genetic and congenital disorders. Fifth classification is mental health disorders or mental illness. Mental illness affect the individual's emotional, psychological and social well-being. So it affects the three aspects of our living, that is emotional aspect, psychological aspect and our social well-being. And which can also influence our thinking, our mood and our behavior. Okay, that is thinking, our mood and behavior with varying degree of severity. Sometimes it may be mild or moderate, or it may be severe problem with our thinking process, our mood, the present status and our behavior or personality. Okay. Examples for mental disorders: depression, okay, anxiety disorders, schizophrenia. It is one particular peculiar disease of mental illness which includes hallucination, delusion, etc. Okay. Then bipolar disorders such as mania, obsessive compulsive disorders such as OCD, obsessive compulsive disorders, and even post-traumatic stress disorders. So after some incidents, a patient or person may go for depression. Okay, that is called post-traumatic stress disorder, that is PTSD. So these are the examples for the mental illness or mental diseases. Sixth type is autoimmune diseases. Autoimmune diseases are nothing but which occur when our immune system mistakenly attacks our own body on tissue. Our immune system may be confused with that is the organism like a microorganism or pathogen like that. Then it attacked our own body tissues or proteins which cause inflammation and tissue damage. Okay, that is comes under autoimmune diseases. So that is a immunity based. Our immune system mistakenly or confusedly attack our own cell, okay, or tissues. That cause inflammation and tissue damage that may lead to some particular or different type of diseases. So these autoimmune response can affect various organs and systems of our body. Example for autoimmune diseases are rheumatoid arthritis, inflammation of the small joints. You can see in this picture, okay, that's rheumatoid arthritis. Multiple sclerosis, that is MS, and Hashimoto's, thyroiditis, inflammation of the thyroid, etc. all comes under autoimmune diseases. Seventh one is cancer, number of cancers. Cancers are nothing but a group of diseases characterized by uncontrolled growth of the cells, okay, or tissues. It can occur in almost any part of the body, okay, and it can spread to other areas. So that is called the metastasis of the cancer. So most of the cancer will spread to other area, that is called metastasis. So there are number of different types of cancer. From that, the most important is breast cancer, lung cancer, prostate cancer in males, and leukemia related to blood related cancer, that is leukemia. So cancers are the group of diseases that is characterized by uncontrolled growth of the various cells or various tissue in a particular place. It may occur any part of the body, and it may be spread to other tissues or other organs, that is called metastasis. The eighth classification of illness or disease is called degenerative diseases. So these are the illness that involve progressive deterioration of the tissues or organ over time. So gradually or slowly it may start. So progressive deterioration means stage by stage degradation of the tissues or organs or cells. Okay, it takes prolonged period, and it is often associated with the aging. So as the aging increase, as the person get aged, our tissue or organ also deteriorated. Okay. Though it is related to aging, but it can occur at any stage of life too. Okay, it can occur even before aging also. Okay, so the example include Alzheimer's disease. Okay, related to memory of the person or patient, Alzheimer's disease, and even Parkinson's disease, usually seen after 50 years. Okay, especially in the males, Parkinson's diseases. So these are the example for the degenerative diseases. It is due to degeneration of the tissue, organ, cells, etc. Now, ninth classification is nutritional deficiency diseases. As the term indicates, it is the deficiency or lack of the different nutritional intake. So these arise from the lack of essential nutrients in the normal diet of the persons. So we have essential nutrients that is required for the balanced growth, optimum health of the persons. So if there is any lack or insufficiency, that may lead to various health problems. Though it is related to nutrition, but nutritional deficiency can affect the various system of the body in the different form of the diseases. For example, marasmus and kwashiorkor in relation to protein energy malnutrition and caloric energy malnutrition. Marasmus and kwashiorkor. So this is the example for the marasmus case. Okay. Then iron deficiency anemia due to deficiency in the iron. Then vitamin deficiency lead to rickets. Vitamin C deficiency lead to scurvy, and vitamin B or B1 deficiency lead to beriberi. So there are many nutritional deficiencies. From that, these are the few examples for nutritional deficiency diseases. Then 10th one is endocrine disorders. Okay, we have endocrine system and various glands that produce the hormone in the body. Okay, so these involves body's hormone producing glands, and that can disrupt or disturb. Okay, it's our metabolic process, anabolism and catabolism. Okay, so these endocrine disorders will lead to disruption of metabolic disorders, or deficiency in the hormone may lead to metabolic disorders. Okay, or disrupt metabolic process. Common endocrine disorders include hypothyroidism and hyperthyroidism, that is related to thyroid gland. Then diabetes mellitus, it is related to islets of Langerhans, pancreatic gland. Okay, then Cushing syndromes, etc. So these are some of the examples for endocrine disorders that is related to hormone producing glands and its hyperfunction or hypofunction. Either increased production of hormone or decreased production of hormone, all will cause different endocrine disorders. Like decreased production of thyroid hormone cause hypothyroidism, and increased production may cause hyperthyroidism, like that. Next is neurological disorders. The 11th classification is neurological disorders. So as the term indicates, it is related to nervous system, neurological system. So neurological illnesses affect our brain, spinal cord, or total nervous system of the body. Okay, so these disorders impact our movement. Okay, body movement, speech, cognition, intelligence, and our emotional regulations, that is thinking, memory, etc. all will disturb related to neurological disorders. Example is epilepsy, stroke, and even migraine, that is a particular type of headache, migraine, etc. all related to neurological disorders or issues or problems. Then 12th one is allergic conditions or allergies. Allergies occur when the immune system reacts to any substance, any allergens or any foreign body, okay, that are usually harmless to most of the people, but in a few people that may cause allergies. Okay, so allergy occur when the immune system reacts to the particular substance or allergen that is usually harmless for the majority of the people, but a few people may get allergy with that particular substance or allergens. Then moreover, allergy can be either mild or it is severe, okay, but a few cases it is life threatening, that is called anaphylaxis allergy, okay. So it is mild or severe, but sometimes it may even go for the life threatening situation, that is known as anaphylaxis. Example for allergic conditions like hay fever allergy, that is hay fever. Hay fever is nothing but allergic rhinitis, that is inflammation of the nose, that is allergic rhinitis. Then asthma, bronchial asthma, okay. Then there are many food allergies. Example is shellfishes, okay. There are many sea shellfishes. A few people may have allergy for that particular shellfish. Then eczema is nothing but an inflammation of the skin, okay, or infection of the skin, that is atopic dermatitis, that is eczema. So these are some of the example for the allergic reactions or allergic conditions. Now 12th one is occupational diseases related to our job or related to occupational setting. So these are the illness that arise due to the exposure to risk associated with the person's occupation or job, okay. So in different industry, different factory, there will be different chemicals, okay, chemicals, substances or dust, etc. So exposure to that particular agent for a prolonged period, that may cause some occupational diseases. Then the cause of occupational diseases may be physical, chemical or biological hazards. Physical is nothing but extreme temperature, heat or cold. Then chemical includes dust, mist, fumes, solvents, acid, base, etc. What comes the example for chemical hazards? Biological hazards are nothing but that is related to some pathogens, okay, bacteria, virus, fungus, parasite, etc. Okay. Examples for the occupational diseases include asbestosis, that is prolonged exposure to asbestos dust will lead to asbestosis. Silicosis, that is inhaling silica dust for a prolonged period by the person may lead to silicosis. And another one important disease is farmer's lung disease, okay. It is a lung disease of the farmers, that is due to inhalation of the dust of the hay grain, okay. Then another one is carpal tunnel syndrome, okay. Carpal tunnel syndrome, that is, see the picture here, that is carpal tunnel syndrome, that is from repetitive motion of the hand with any machines or any other machineries in the occupational settings. So these are some examples for the occupational diseases. Then 14th one is lifestyle related or lifestyle diseases. So these illnesses are often linked to our lifestyle practices or lifestyle factors, okay. That is having poor diet, lack of physical exercise or physical activity, habit of smoking or excessive alcohol consumption, etc. All will lead to lifestyle related diseases. For example is obesity, type 2 diabetes mellitus, hypertension, liver cirrhosis and even cardiovascular diseases, okay. All may be because of the lifestyle practices. Because of that it is called lifestyle diseases. Then 15th one is others. So there are many such classification or categories of illness according to their cause, according to their origin, according to their course of disease, duration, according to their severity, etc. So today we have discussed about the main types or categories of diseases such as acute illnesses, chronic diseases, infectious diseases, genetic and congenital disorders, mental health disorders or illness, autoimmune diseases, cancers, degenerative diseases, nutritional deficiency diseases, endocrine disorders, neurological disorders, allergic conditions, occupational diseases and lifestyle related diseases or lifestyle diseases. Thus, in summary, illnesses can be even classified into various categories based on their origin, okay, based on their etiology or cause, based on their course, that is a period or long period or chronic in state, and based on their impact, okay, that is mild, moderate and severe. Understanding these types or categories of different illnesses and various diseases helps the nurses to identify various risk factors and etiological factors, and also helps to provide potential treatment and prevent or to make different preventive measures or preventive strategies for each category. So understanding of these types of various categories of diseases or illness helps the nurses in identifying the various risk factors and etiological factors and to provide potential treatment or specific treatment or even prevention of such diseases or illness by following various preventive strategies or action plans for each type of category of diseases or illness. So thanks for watching. Hope this video really benefits in your studies and exams. If you feel it is really worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the next academic video. Okay. The important thing is, don't forget to subscribe my channel and mention your gratitude in the comment box. Once again, thank you for watching my video.